this is Caitlin Reed. Welcome to my CLAS training module for our CHP 440 class, Health, Culture, and Diversity for winter of 2021. The organization that I had in mind with this training video is Comprehensive Life Resources. They are a private, non-for-profit community mental health agency that provides a continuum of behavioral health and community support services. They are committed to a recovery-focused, holistic approach, and they hire social workers, therapists, case managers, peer support counselors, psychiatrists, nurses, nurse practitioners, and a lot of other types of health specialists in their agency. So what is CLAS and why use it? CLAS stands for Culturally and Linguistically Appropriate Standards. CLAS was developed by the Department of Health and Human Services, Office of Minority Health, to provide a guideline of understanding and to promote health equity, increase quality, and help eliminate disparities. Why would we use CLAS at a place like Comprehensive Life Resources? It is a national standard that provides organizations with specifications that it can adopt to achieve its competency goals. It increases cultural and linguistic competency of a company's infrastructure and services, and it helps an organization comprehend cultural and communications characteristics. This little diagram over here was created by the Department of Health and Human Services, and it just shows how these three aspects interconnect together: the advance of health equity, improving quality of service, and to help eliminate the disparity. So the goals that we wanted to work towards when implementing CLAS into our organization are going to be to develop policies within our company that prioritize cultural humility and promote a diverse governance in the workforce, to apply CLAS goals, policies, and standards in our clinical practice, community outreach, data collection, and training, and to evaluate continuously in order to maintain competence and standards. When I'm speaking about goal number 1, developing policies within our company that prioritize cultural humility and promote a diverse governance and workforce, what I mean is to ask ourselves, what policies do we adopt? Do we have a culturally diverse staff? We know right now that there's a lack of diversity in the mental health field in both the people who are going through the educational pipeline and the people who are currently working in the field. Do we provide communication and language access services to our patients and our clients? Does our leadership support programs that target culturally diverse populations? And are we collecting and utilizing demographic data to provide our clients with culturally appropriate services? And the data that we could collect to provide these services could be, for example, gender, race, ethnicity, language preference, religion, and more. And while we're speaking of policies to adopt, I wanted to mention here just a few of the training opportunities that have been identified that could be implemented here in the mental health field when it comes to CLAS training, like how and when to access language assistance services for people with limited English proficiency, how to provide delivery of service to particularly underserved populations, such as those living in rural communities or with varied religious backgrounds, ensuring that fiscal human resources, tools, skills, and knowledge to support cultural and linguistic competence practices are available for the organization, and providing education and training incentives at work to demonstrate a recognition of the importance of the provision of services and care when it comes to cultural and linguistic competency. For our second goal of applying CLAS goals, policies, and standards in our clinical practice, community outreach, data collection, and training, there are many ways to go about this, but here are a couple that I noted. One of them is what the Joint Commission suggests, which is creating materials in alternate formats for individuals with different needs, such as people with sensory developmental needs and or cognitively impaired. And then research also suggests that care is improved when we use interpreters. And one of the things that is key when using interpreters brings us to our third point, which is training bilingual staff in conjunction with offering an additional method on interpretation, such as remote video interpretation, which will create a multifaceted approach for language assistance, which I actually will jump to the next slide for another addition onto that point. Here I wanted to talk about 4 things that we can implement that will ensure we are following CLAS standards and that will allow us to follow the best possible language assistance and care standards for our patients and clients. And so for number 1, we're going to translate written materials into languages that are appropriate for the populations we serve. We're going to get that information from the data and the demographics information that we collected from a couple slides back. For number 2, we're going to educate community members, patients, and clients about their rights. We want all the people who come into our organization to know that they have the right to an interpreter, and we want all of them to know that this information is available to them when they come and seek our services. Number 3, we want to test all hires that identify as bilingual in language proficiency. We want people that are hired here at our organization who tell us that they're bilingual to actually prove to us that they are able to interpret for our clients and not just tell us that they are able to interpret to our clients. And then number 4, which I was mentioning one slide ago, that connects with that last point, is that if you hire a shared remote interpreter, it's a low-cost option of service for when in-house interpreters are not available. So if you use a method like that, you can ensure that when you have clients that are coming in, you will never be without an interpreter for them. So for our last goal, we want to evaluate continuously in order to maintain our competency and standards. We want to use the information that we gathered from our assessments and evaluations to customize our services to be relevant to the community. We want to sample our test materials with members from the intended communities before we implement them in full. We want to make sure that they are not harmful, we want to make sure that they are helpful, and we want to test them to make sure that they are going to provide us with the intended goal. We want to hold meetings regularly to discuss if our cultural and linguistic goals and objectives are meeting the needs of our community. We want to utilize the community members as a resource for evaluating materials to see if they are culturally insensitive, offensive, inaccurate, etc. And then we want to involve the community members to serve as liaisons or consultants when it comes to representing diversity of a target community, because they will be able to tell us and provide the information that's most appropriate and accurate as an example for what we are providing to them. So we just wrapped up our 3 goals, and I wanted to talk a little bit about why they are so important to implement in the healthcare field and especially with the mental health services. We know that patients whose providers were motivated to learn about their cultures within their practices and organizations were more satisfied with their visits, perceived that their providers were more facilitative, and reported seeking more information after their visit. Receiving mental health services is a very delicate thing to balance because when you're receiving mental health services, you are interacting with the cultures of the organization, the patient, the mental health provider, and mental health culture in general. Misunderstandings can occur between any of these factors with a patient and provider relationship. So it is really important to try to maintain competency and cultural humility wherever you can. There are significant consequences when cultural norms are violated, even if the violation is unintentional. As I said before, mental health is a delicate topic to navigate, and it's handled differently in every culture. Misunderstandings in a patient-provider relationship can lead to a lack of trust in their provider and mental health care, misdiagnosis, poor clinical results, and a low adherence to treatment plans, provider advice, and prescribed medications. And this could mean just for the relationship with that patient and that provider, but it could also cause a lack of trust with that patient and any future provider. So finishing off here, I just wanted to say that it's our responsibility as healthcare professionals to offer the best care possible to our patients. Being a culturally and linguistically competent organization is key to providing equitable mental health care. I wanted to say thank you to everybody for watching my presentation. I have a couple of pages of citations to follow.